Hi, I'm Dr. Peter Schoch, CMO of IHS and Senior Vice President for Population Health and Post-Acute. And this month, I'm happy to be filling in for IHS CEO Mike Thompson as your Performance Platform Senior Leader Message Coach. Those of you who were able to attend our summer town hall sessions got to hear a little bit about Pop Health and how it integrates with the work we're doing in IHS. This month, we're going to take that discussion and go a little bit deeper. On this first slide, I ask your team what they think the definition is for population health. Then click to reveal the definition and walk through what it means to you and how it connects to the work your team does every day. Population health is the aspirational outcome of a people-centered, whole-person care delivery model that improves the quality of life for individuals and populations, addressing all determinants of health, and by providing convenient, connected, and complete care across a seamless continuum. I'd like to point out two important parts of this definition: whole-person care delivery model and determinants of health. In value-based whole-person care delivery model, our providers are asked to provide preventative care to patients in order to ensure diseases are identified early and/or are appropriately managed, resulting in healthier patients and lower overall cost of care. By addressing the whole person, we will improve outcomes and improve the consumer experience. It's a win-win. And for us, it aligns with our brand promise of providing whole-person care. On this slide, I want you to help your team understand the determinants of health, which is basically, for any given consumer on average, what determines their health. As you know, a person is more than just their clinical disease, and population health is a care model that addresses that whole person. So let's look at the breakdown of what determines your health. Only 10% of what determines whether an individual is healthy or sick is related to the presence or absence of clinical disease. 10% is related to genetics, and that could become 20% after our genomics lab gets up and running and we understand more about how genes affect our health. Our healthcare providers, myself included, are educated and trained to manage only 10% of what makes you healthy or sick. It's amazing to think about, right? So how can we affect total cost of care, quality outcomes, and experience if we're only addressing 10% of what makes you sick or healthy? The vast majority of what determines health or illness, the remaining 80%, is related to social or behavioral determinants of health. This is why it's important for us to care for our patients in body, mind, and spirit. Care for the whole person. If most medical providers are only trained to take care of 10% of what makes us sick, how can we affect total cost of care, quality outcomes, and experience? This is the gap. We're not addressing the 80% of what makes us sick or healthy. And this is where Pop Health comes in. Remember, it is a whole person care delivery model that addresses all of what makes one sick or healthy. And that is where we need to go. At this point, I'd like you to paint a picture for your team with a quick story. And then ask your teams their thoughts about their role in population health or even their own health. To illustrate this principle, I often tell the story of a woman with diabetes who shows up in the emergency room at the end of the month. Why? Because after she's paid for her mortgage and other bills and fed her loved ones, she doesn't have enough money to feed herself. Because she has diabetes, she must eat right to take the medications to control her diabetes. But she can't afford to, and at the end ends up in the emergency room and now has even higher bills. In our new care model, we address these components and social determinants of disease. As a doctor, I may know the cause, but how do I address it? Where do I send her for help? Give your teams time to answer, then ask them to ponder this question. What if a $100 box of food made the difference in thousands of dollars of healthcare costs? Close the loop with your team with the following. As you can see from this story, unaddressed social and behavioral determinants of health lead to acute illness, complications from poorly controlled chronic disease, and care at high-cost venues of care. For example, an emergency room instead of an urgent care, or perhaps no need to go to the doctor at all. We cannot begin to manage risk if we do not address the whole person, all the determinants of health, everything that makes one sick or healthy. We cannot address what we don't know, so we must screen for these factors at every encounter. Once screened and identified, we can help our patients if we have the right resources allocated, care model developed, and that care model integrated into the community for sustainable impact. I look forward to hearing of your thoughts and discussions on this. Hope you all have a great meeting.